Last week, the Trump administration announced a bold new plan to stop the disturbing trend we're seeing of rising deaths due to COVID-19 here in the U.S. They're going to encourage strong legislation requiring masks in public. They're going to keep schools and businesses closed, and they're going to outfit our medical professionals with all required personal protective equipment. Okay, no, I'm just kidding. They're just going to hide the data so that we can't tell how many people are dying anymore. Maybe they won't hide the data. They haven't come out and said explicitly that they're going to hide the data. Here's what they have said. First, Trump said that increased coronavirus testing made the U.S. look bad. Quote, "So I said to my people, slow the testing down." He made it very clear that he would prefer to hide the scientific data in order to make himself look better. And then he said that from now on, hospitals should no longer report their COVID-19 data to the CDC, and instead they should only report it directly to the U.S. Department of Health and Human Services, or HHS, who will do something with that data. Something way better than what the CDC was doing with it, like making Trump look better, perhaps. If you're not too worried about all of this, maybe think back to the last time I mentioned the HHS in a video. That was back in March when I was talking about why our hospitals ran out of N95 masks and other PPE. Was it due to the average citizen hoarding masks? Or was it due to the fact that our strategic national stockpile, which is meant to supply hospitals with necessary equipment in the case of emergencies, had only 12 million N95 masks at the start of the year instead of the 3.5 billion masks that we needed? And why was the stockpile so poorly stockpiled? Did it have anything to do with Trump taking the stockpile away from the CDC and giving it instead to the HHS Assistant Secretary for Preparedness and Response? Make you think. So previously, hospitals were reporting their data to the state, the CDC, and the HHS. And that data included new COVID-19 infections, deaths, and the percentage of hospital beds that were in use. The CDC made it part of their mission as a public health agency to make that data available to the American public, which allowed third-party groups like COVID Exit Strategy to scrape that data and display it in an educational way that would allow us lay people to quickly and easily see where cases are rising, where hospitals are about to be overwhelmed, and where state policies are getting the disease under control. The HHS was already getting this data, but they do not make that data public, which is why it's strange that the Trump administration is now asking hospitals to simply cut the CDC out of their reporting. I mean, it's strange if you have no deductive reasoning skills and are unable to take a guess at what their ulterior motive may be. Here's a hint, they're a wannabe fascist dictatorship run by a semi-literate, egotistical man-baby who has admitted in public that he has asked his flunkies to hide the data to make him look better. The very minor bit of good news is that the general public still has access to sites like Johns Hopkins COVID-19 Case Tracker, one of the most highly trafficked sources of COVID-19 information online. Johns Hopkins doesn't scrape the CDC for their data, and instead they get that information right from the source. It really drives home the importance of the fourth estate during an administration like Trump's. In the US, our government is run based on 3 branches of government, all of which are meant to have checks and balances that prevent any one branch from seizing control of the country. The Republicans have spent a considerable amount of effort eroding those checks and balances by, for instance, using dirty tactics and spineless Democrats in Congress to block Obama's rightful Supreme Court pick of Merrick Garland so that Trump could then put the alcoholic sex pest Brett Kavanaugh on the court, switching the court from a liberal to a conservative majority, just to name one random example. And that's why we have the fourth estate, the press. Journalists are meant to expose this kind of tyranny in the hopes that the public will rise up and do something about it, which is why the Trump administration has also spent so much time and energy attacking the free press as well. The fifth estate was recently coined to include bloggers, social media users, and other reporters outside of the mainstream media who are also now doing that important work. But honestly, I personally see all of it as one critical check against a tyrannical government. It occurs to me that in these times, that in addition to media and non-mainstream media, we should also consider scientists like those at Johns Hopkins to be in that fourth estate. Trump is currently attempting to hide scientific data in the midst of a pandemic that has thus far killed nearly 140,000 Americans. And our representatives and our courts are simply not working hard enough to stop him. At the very least, we can be grateful for those who are both exposing what he's doing and finding that data and making it accessible to the public despite Trump's orders. So well done to the hardworking scientists at Johns Hopkins, to the anonymous whistleblowers at departments like the CDC, and to all the journalists who aren't letting Trump get away with his fascistic, anti-science, anti-public health decrees without a fight.